Nasal/sinus endoscopy, surgical with frontal sinus exploration, with or without removal of tissue from frontal sinus. The physician uses an endoscope for surgical resection of the frontal sinus. Topical vasoconstrictive agents are applied to the nasal mucosa and nerve blocks with local anesthesia are performed. The endoscope is placed into the nose and a thorough inspection of the internal nasal structures is accomplished. A scalpel or biting forceps is introduced parallel to the endoscope and is used to remove diseased tissues from the frontal sinus. Polyps are removed. An antrostomy is sometimes performed, creating an opening for drainage from the maxillary sinus. Electrocautery may be used for hemostasis. The nasal cavity may be packed with telfa or gauze for 24 to 48 hours. Nasal/sinus endoscopy, surgical, with sphenoidotomy. With removal of tissue from sphenoid sinus. The physician uses an endoscope for surgical access of the sphenoid sinus. The sphenoid can be explored with direct access or through the posterior ethmoid sinus. The isolated access to the sphenoid sinus is through dilation of the sphenoid ostium. The middle turbinate may be fractured or partially removed for access. The ostium is cannulated and dilated. The physician uses forceps or a sphenoid punch to open the sinus cavity. Additionally, diseased mucosa or tissue is removed. Indiana 31288. The nose may be packed if excessive bleeding occurs. Nasal/sinus endoscopy, surgical, with repair of cerebrospinal fluid leak, ethmoid region. Sphenoid region. The physician uses an endoscope for surgical access and repair of cerebrospinal fluid leaks in ethmoid and sphenoid sinuses. Topical vasoconstrictive agents and local anesthesia are applied to the nasal mucosa. The endoscope is placed into the nose. The middle turbinate may be fractured to provide access. The ethmoid sinus is entered through the ethmoid bulla. In 31291, the sphenoid sinus can be explored through the posterior ethmoid sinus or through direct access. If accessed through the ethmoid sinus, the sphenoid ostium is cannulated and dilated. The physician uses forceps or a sphenoid punch to open the sinus cavity. Once the sinus cavity is entered, the cerebrospinal fluid leak is isolated. Local mucosal or muscle flaps may be developed to plug the defect. Autologous fat, muscle, or fasciolata may also be used to seal the leak. Nasal/sinus endoscopy, surgical with orbital decompression, medial or inferior wall. Medial and inferior. The physician uses an endoscope for surgical access to decompress the orbit. Decompression may occur through one orbital wall. Indiana 31292 or through two orbital walls in. The inferior orbital wall is approached through a canine fossa puncture into the maxillary sinus. The inferior orbital wall is the roof of the maxillary sinus. Forceps remove orbital bone while preserving the orbital periosteum. This allows orbital contents to herniate into the maxillary sinus. The medial orbital wall can be approached through the ethmoid sinuses. The ethmoids may be opened through the maxillary sinus or by a separate intranasal ethmoid approach. The medial wall of the orbit is the lateral wall of the ethmoids. Bone is removed from this region, also allowing orbital contents to herniate into the ethmoid regions. The nose may be packed if excessive bleeding occurs. Nasal/sinus endoscopy, surgical with optic nerve decompression. The physician uses an endoscope for surgical access to decompress the optic nerve in the posterior orbit. The optic nerve sends transmissions that provide the sense of sight. This nerve enters the posterior cone through the optic foramen, orbital apex. The orbital apex may be approached through the sphenoid sinus. The sphenoid sinus may be explored through the posterior ethmoid sinus or directly. The middle turbinate may be fractured or partially removed to provide access. Isolated access to the sinus is through cannulation and dilation of the sphenoid ostium. The physician uses a forceps or a sphenoid punch to gain entry into the sinus cavity. Bone is removed from the lateral portion of the sinus, decompressing the optic nerve. The nose may be packed if excessive bleeding occurs. Nasal/sinus endoscopy, surgical, with dilation, e.g., balloon dilation, maxillary sinus ostium, transnasal or via canine fossa. Frontal sinus ostium. Sphenoid sinus ostium. Frontal and sphenoid sinus.